Hi everyone, my name's Katie. I'm a midwife at Brighton. I work on labour ward at the moment, and I've come on here today to talk to you about induction of labour. So I thought we'd just start with looking at what happens when you go overdue and when we recommend induction of labour and what happens in the process. And then we can just go into what happens when we offer or recommend induction of labour for other reasons as well. So if you do go over your due date, what will happen is that you'll be guided by your community midwife, and they can offer you what we call a sweep, and that is just sweeping the cervix, so the neck of your womb, just to see if that can just stimulate and release some natural prostaglandins that sit in your cervix, to see if that will just maybe start gently your labour starting. And that can be done in the community by your community midwife. And then once you're a few more days overdue, and again, that your community midwife will guide you on this, we would then offer you induction of labour. So for the actual process of induction of labour, we would invite you into our midwifery assessment unit at the hospital, which is on level 12. And there you will see a midwife, and they would check you over, so do your blood pressure, temperature, your pulse, and they would obviously then check your baby over. And that means having a continuous monitoring of your baby's heartbeat, which takes about half an hour. So you sort of have to be strapped up to the monitor for about half an hour. And we just want to make sure your baby's well, moving well, so that we can proceed with the induction of labour. If everything's okay, we would then offer you an examination, and we would like to actually see what your cervix is feeling like. And we actually give it a special score. It's called the Bishop score, just to see if there's been any progress at all in your pregnancy, or maybe you've started to have some tightenings already, or maybe starting to go into early labour. So you're given a score, and then depending on what the score is, we would then give you a pessary, and that is actually called ProPess. And it's like a really mini tampon, and we just insert it with our fingers, just when we put it next to the cervix, and we just leave it there, and we can leave it there for 24 hours. So once you've had the examination and had the ProPess inserted, we then leave you for another half an hour on the monitor, again, just to make sure your baby's okay and coping well. And then if everything's absolutely fine, we send you home. So this is what's amazing about this part of the process of the induction, is that you get to go home, and actually, we're finding that women are responding really well to ProPess, and I think even more so because they're in their own homes, have their own oxytocin releasing, and are just feeling a lot more relaxed. So hoping that early labour will start in those first 24 hours after you've had your ProPess. So if obviously any time in that first 24 hours and you're at home, if you have any worries, or you feel like you're going into labour, or your waters might have broken, or you're having lots of show, those kind of things that might be a sign of labour, you just need to obviously stay in contact with us at the triage, at the maternity assessment unit, speak to the midwives regularly, and we can just guide you to say if you need to stay at home or you need to come back into the unit just to be assessed. So if you do come into the unit to be assessed for labour, we would just treat you like any labour assessment, and hopefully you're in labour, and you can stay with us and we'll be transferred to labour ward. If for any reason nothing really happens in that first 24 hours, we'll invite you back in at 24 hours after the first ProPess, back into the midwifery assessment unit, and we would again check you over. This can either be done on the midwifery assessment unit, or you might be asked to go to the antenatal ward. If this is done and we've done another examination, we've checked your baby over, same process by monitoring your baby again on the monitor, we'll examine you. if you are getting to the point where the cervix is starting to open a little bit and you have actually responded to the first PROPES, we would then recommend the next step of induction, and that is having your waters broken. If your cervix isn't open enough to have your waters broken, we would then pop in another PROPES pessary, which is that small little tampon. And what we would do, we would actually we did then recommend you to stay in hospital with us for the next 24 hours. So that will be on the antenatal ward, and it's just where we can monitor you a little bit more closely, especially as it's the second day of you having those hormones, okay? Obviously, if we do break your waters with that second examination, we then want to see what happens really. So we'll give you a good sort of 2 to 4 hours to get you to mobilise, walk around, and hoping that, you know, maybe labour starts progressing more, your cervix starts responding, and you start to dilate a little bit more. And then, you know, if we feel that labour is progressing, we will leave you and let you labour as normal, okay? If by any chance that after breaking your waters you don't respond so well and the contractions aren't as strong as we would hope for labour, or your cervix isn't dilating, we would then recommend the oxytocin hormone drip. So it's a synthetic hormone, very much like the hormone you have in your body that helps labour progress, but we can actually give you this synthetic form of a hormone. And it's delivered to you by an intravenous drip, so that means having a cannula in your arm or your hand. And then we would actually start this drip, and we start it very, very small amounts, and then we increase it every half hour just to get your right amount of contractions. So we're looking for about 4 contractions in a 10-minute period. And once you've achieved that, we just leave you with the drip, continue with that until you get to fully dilated and you're ready to, you know, see your baby, push your baby out, okay? Just so you know that if you do have the oxytocin hormone drip, the synthetic hormone drip, we always like to monitor you with a continuous monitoring in labour, okay? Just to keep a closer eye on baby. And obviously, we would continue that continuous monitoring until your baby is born, okay? Obviously, with what's really important to know about the induction of labour process, it can be long. It, you know, especially if it's your first baby, be prepared that, you know, it could take you like 2 to 4 days sometimes to actually have your baby in your arms. So preparation is key, especially the people that are being induced at the moment. With what is going on currently, is that birth partners can't be present on the antenatal ward. They're only allowed to be present once you're on labour ward. So it's really important that you try to just keep yourself entertained as much as possible. So prepare with some food and you know, magazines, books, films on your laptop, etc., just to keep you sort of, you know, entertained. But as soon as you go onto labour ward and you're in your own room, obviously your partner will then come up and can support you in labour, okay? And do remember, we really want to support normal birth and the normal process. So when you do go overdue and you are recommending induction of labour, some women do need the whole process of the pessaries, then having their waters broken, and then the hormone drip. But some women don't, and all they need is the pessary just to kickstart them into labour. And as long as you are responding to that and you're progressing and labouring well, we will support you in normal birth and normal labour, okay? So that's important to know. And obviously, the longer you can leave to actually be induced, so, you know, looking around 10 days overdue, 11 days, that sort of thing, your body's going to respond better to induction, because your body's going to be more ready to be induced at that point, okay? Okay, so that's talking about normal, like a normal overdue induction of labour. For any reason